Hello, I'm Dr. Michael Carroll. If you are one of the 48 million shoulder pain sufferers in the United States, you need to listen to this commercial. The shoulder is a remarkable joint, allowing for a 270-degree range of motion. When the shoulder becomes dysfunctional and painful, there are a few aspects of your life that are not affected. Listen to some typical shoulder pain symptoms.
It was affecting my sleep, and it was affecting playing, like I said, playing with my son, playing football and baseball in the backyard. And it was uncomfortable.
My whole body was limping, all right, and I was limping from the shoulder. My shoulder was drooping, all right, and I had that look in your eyes that you have something that's really bothering you, all right, and very difficult to smile, and you're smiling through a pain.
And I was always waking up with pain or having to adjust myself.
If these patients are similar to you, then you'll be happy to know that we have developed a solution. To understand why the Rotator Reliever is such a remarkable treatment for the shoulder, you must first understand what is wrong with your shoulder. The rotator cuff is a set of 4 muscles that basically keep the ball of the humerus in the socket of the shoulder blade. Problems begin for the rotator cuff when the supraspinatus tendon is pinched between 2 hard objects, the humerus and the coracoacromial ligament. This pinch robs the tendon and muscle of blood and nutrients and causes rapid degeneration of the tendon. During the day, the weight of the arm acts as a traction that opens the space. At night, that traction is lost, causing the arm to migrate superiorly, causing the pinch or impingement. Think about this. You are injuring the shoulder during rest just when your body should be rejuvenating. This is why your problem has been so difficult to treat. All the good things you are doing for your shoulder during the day are negated by the nighttime impingement that is robbing the rotator cuff of blood, oxygen, and nutrients it desperately needs. Our solution to this daily cycle that destroys your rotator cuff is to treat day and night. We tested our treatment plan and achieved dramatic results. 100% of patients treated by the Rotator Reliever got better in 28 days versus only 47% treated the usual way. In our world, this was a home run. The results of our study showed statistical significance. This basically means that it worked really well. We were able to publish the results and present them at the American College of Sports Medicine National Meeting. Let me show you how our system works. The nighttime component places a specific amount of traction on the arm and is to be worn for between 3 and 6 hours at night for 28 nights. This decompresses the rotator cuff, preventing injury and allowing blood flow for healing. The daytime exercise component utilizes the strategy of dynamic stabilization and isolates the rotator cuff. Too many attempts to strengthen the rotator cuff only strengthen the overlying musculature of the pectoralis, trapezius, and deltoid muscle groups. High repetitions, centripetal forces in multiple positions exercise the entire rotator cuff. This serves to tone the other 3 muscles of the rotator cuff and further prevent impingement on the supraspinatus, or top of the rotator cuff. In addition to exercising the right muscles, our device gets this done in an efficient 5 minutes per day. Listen to these success stories.
To me, Rotator Reliever did 2 things. One, it helped my wife get better sleep at night, and it helped me play with my son out in the backyard, play catch again. So those are 2 things that, to me, was totally worth it.
Now I was back to normal. I could move, I could rotate, I could do things with my arms, both arms now, all right, and it was like it never happened.
And it got me back to a normal activity level.
It was painful, and I had to do something.
To get relief like that is worth anything.
We are confident we can help you, and that is why we have a 30-day money-back guarantee. Call 1-888-ROTATOR and get your Rotator Reliever today.